Doctors recommend kids between the ages of 9 through 11 years old get the human papillomavirus vaccine, which can protect them later in life from certain cancers. A recent study from the University of Arkansas for Medical Sciences found that many Arkansas parents feel hesitant about letting their kids get vaccinated against HPV. The lead researcher explains to 5 News reporter Kayla Davis why she and her team believe parents feel this way.
According to the Centers for Disease Control and Prevention, about 90% of cervical cancers come from human papillomavirus or HPV. In 2020, almost 12,000 new cases of cervical cancer linked to HPV were reported across the U.S., disproportionately affecting women of color.
We have a lot of research that shows vaccination against HPV is the best way to prevent any specific HPV-related cancers from developing. Almost a 90% prevention there. So it really is a very good preventative measure.
Dr. Rachel Pervis led a team of researchers at UAMS that surveyed around 2,200 Arkansas parents about getting their child vaccinated against HPV. They found that 1 in 4 parents are hesitant. But why? Dr. Pervis says that uncertainty comes from a lack of communication.
This desire for clear, understandable information about the vaccine, about the vaccination side effects, and in the effectiveness of the vaccine. And also that provider recommendation was very, very important for these parents in terms of overcoming their hesitancy.
Despite initial hesitancy, the researchers found many parents still had their children vaccinated.
While they may have been concerned about the vaccination and its side effects, knowing that they were going to help prevent or potentially, protect their child from getting cancer really helped them overcome that hesitancy and choose vaccination.
The study calls for medical providers to empower parents with information. Dr. Pervis says they plan to do just that.
Letting providers know that not only do parents want this information, but just making sure they talk to them and just don't assume that vaccine hesitancy has gone away.
Covering news where you live, Kayla Davis, 5 News.
Dr. Pervis says the study also found many parents are struggling with the simple access to this vaccine. Some primary care doctors don't stock it at their clinics, so parents might have to find the HPV vaccine at pharmacies or even county health units.